The CDC just released the 2022 STI Surveillance Report, where they state that the number of cases in 2022 was the highest they've seen since 1950. And the number of cases has increased 80%. That's a huge number in the past 5 years. In Seattle and King County and at Harborview, we are seeing a great increase in the number of syphilis cases. In the last 2 years, we've seen an increase in women by 90% each year in the incidence of syphilis from 2020 to 2022. Now, compared with symptomatic syphilis, people who have clinical manifestations, what we're seeing is that there's a large proportion of those syphilis diagnoses in women are asymptomatic. And what that means potentially is that there's a large reservoir of undiagnosed infections that are circulating in the community. With that increase in syphilis that we're seeing in women and in persons who can become pregnant, we have this increase in congenital syphilis cases. And that's a huge problem. There needs to be increased awareness and increased testing because syphilis is affecting a lot of populations and a lot of different populations. Syphilis, also known as the great imitator, can have multiple clinical manifestations. I would say if someone is sexually active, not necessarily in a mutually monogamous relationship, they should get STI testing if any clinical signs or symptoms arise. I think that would be an important part of their sexual health care.